The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's wonderful to have you with us on this dimension of House Call. We are discussing today what is chiropractic. This is a series of discussing neck and back problems and the nervous system, and this is the thoracic spine, which of course is the mid-back, so there are a lot of people that have mid-back problems, and many times those mid-back problems are related to neck problems and lower back problems. So I think you're going to find this very, very interesting. And what we're going to do is start with a little statement that says the absence of disease does not indicate the presence of wellness. Now, what does that mean? It means that I can be standing here or sitting here before you and say, gee, I feel good, I look good, I'm handsome, I'm just the sweetest guy in the world, but I could be having heart trouble or digestive problems or maybe joint or back pains. So just because I may look healthy and feel healthy on the outside doesn't necessarily mean that I have wellness on the inside of myself. And as chiropractic physicians who are natural health care practitioners, we're looking at wellness from the whole person perspective, just not from the physical dimension or and the psychological dimension, but the spiritual dimension as well. And that's why we're bringing up a scripture here that Jesus himself said, and it's recorded in St. John chapter 6, verse 63, that says, "The gracious life of God flows within me, bringing healing to every fiber in my body." Well, what does that mean? We're adapting that in a personal way, that Jesus told us that the gracious life of God, the favorable life of God, the wonderful life of God that he has for his children is flowing within us constantly, because when we accept Christ as our Savior, his Spirit, the same Spirit that was within his Spirit, enters our spirit, it becomes born again, and then we have the opportunity to come into the supernatural dimension of healing of our whole person. So it affects every fiber of our body, every chemical, every neurotransmitter, every digestive action, just everything within our entire body. And so why do we talk about that? We talk about that simply because we don't impose our spiritual beliefs on anybody, but because we are a nonprofit organization, technically a church that sponsors the program. We want to tell the truth. But we don't impose that on anybody and when they attempt to make appointments to see Dr. Jensen or I in our clinic, because that's another dimension. But hopefully it is the Spirit of Christ that's leading us in trying to make the decisions of what diagnostic tests your symptoms may indicate and what treatment program your condition might indicate. So we believe that Jesus is the great physician. We have no second thoughts about that. He's proved that to us over and over and over in many years and performed many miracles, and we've seen many people get well under natural chiropractic care because of the Lord's anointing. So Dr. Jensen is going to begin to discuss subluxations that occur throughout the spine, and he's going to discuss that now. Dr. Jensen, please.
Thank you, Dr. Lala. Well, subluxation, as we can see on one of these slides here, is that it has a definition of that. It's an incomplete dislocation of the bone in a joint. And really, what it's looking for is we take the root word is luxation, and that's a medical term which means dislocation. So subluxation means that it's not dislocated, it's just purely malpositioned. And so if we go back to this slide now, we can see that on this spine that we have, and we're going to bring up the cursor here, a little arrow that you see on your screen. You can see on the top here in part A, you have a disc. And this disc is actually adhered onto each of these vertebrates by kind of a calcium type glue, should we say. It's just grown together. And so when you have this bone here that's pushed out of place like that, it actually starts to tear away at this disc. And now this one that's blue here is still fairly good, but the one down below in red has lost its functionality because it's just been torn too much. Now in between here we have a hole between these two vertebrae, and it's called intervertebral foramina, and foramina means tunnel. And through that tunnel follows the nerve. Now this is a healthy nerve because it's not being compressed, but not only through here does the nerve flow, but we also have vasculature, your arteries and veins that are going to and from the spinal cord. You have acupuncture meridians, lymphatics, all those things that are there to help the function of the spine or of the spinal cord and the nervous system there. And what happens is when we have a vertebrae that's malpositioned like this, it starts to compress things within that tunnel. And the first thing that gets compressed is the vasculature. And really, when you look at the vasculature, those arteries and veins travel like 3 sections up and 3 sections down. So it really takes a toll out on a great area of your spinal cord and what that relates to, because these nerves travel then to different tissues of the body, and that can be bone, skin, organs, you name it. And it can affect that, and that's where some of the effects of illnesses can come from. And by correcting that area, it can have widespread ramifications for your body in correcting that. It's much like if I was pinching off, say if I took a rubber band or a string and wrapped it around my finger really tight. And what you'd find is that it would start to change a little color, and after a while it'd start to feel a little bit different. And after a while there, it'd start to have a hard time bending and functioning and so forth. And then all of a sudden, after seeing that and realizing that, which what we find is subluxations, we cut that string and let it loose. And the function of that thing returns within minutes. And sometimes much, much faster than that. And that's part of the magic of chiropractic, shall we say, with relieving that pressure upon nerves and other structures throughout that intervertebral body. Now, if we go a little bit closer into this, what we call this is a motor unit, and it's comprised of a vertebrae and another vertebrae, the disc in between, and then, of course, all the structures that are intermingled in there. Here we see the spinal cord as it goes through the spinal canal, and a nerve that comes out through the intervertebral foramina, which we talked about, that tunnel, and of course the disc. And as long as those things are lined up, the integrity of this whole system is intact. So then if we go on here, we can see another view. This is the spinal canal where the spinal cord traverses through. It's the yellow that you see in the picture here. And of course the nerves coming out, and it's in front of these bones here that are little levers there in which muscles and ligaments attach to help the strength that allow us to stand up. And of course, as Dr. Lala has pointed before, he believes, and I like this belief, is that those that were actually levers that were placed there for the chiropractor to help affect healing onto the body. We also have the back. This is the spinous process. These are those little bumps. If you bring your finger down your spine, you feel the bumps back there. That's this bone peeking out. And so we'll go on. This is the front vertebral body. This is where most of the weight of your spinal column is supposed to rest. So then as we go on here, we're going to see from the back. This is the posterior elements, as we like to call. And what we see is we see a couple of joints back here. And these joints are actually, they have a joint capsule around them, which we call a synovial capsule. And that is given to having a lot of inflammation can occur in there, which will change the relationship of this joint and actually hold this joint out of position and cause, say, if this is bent up this way, if this whole thing is tilted this way, you end up having a little compression of this nerve here, or if there's a twist or some kind of misposition between these two vertebrae, it can have ramifications on the nervous system. And of course, chiropractic, you always hear about us moving bones, but it's really all about the nervous system and about relieving pressure on the nervous system, relieving that noise that's in the nervous system, and helping the body to restore itself to health, restoring its communication to all the parts and members of its body so that it can affect healing, and looking at the body's intelligence to do that. So let's go on to the next slide here. And this is actually looking at how a person, you see a person up here who's in the center that's he's not feeling too good. And if you look at if that nervous system has interference, as well as what we find is if we put junk into the body, toxic chemicals and so forth in your environment, put that in the body has to deal with this. And if the communication is messed up in there, the function goes away, and we're just not able to handle that. And so what happens is we look at the old adage, garbage in, garbage out. And part of that garbage in, garbage out thing is how you can respond to your environment, because that's what life is. We've got a life inside and a life outside. And how you can respond to that, such as an athlete. He has to respond to different stimulus from outside to be able to react to it lightning quick. And that's how we get good athletes, right? You look at like a baseball player who's at the bat, and he's looking at the threads on that ball as the pitch comes in to determine what kind of pitch it is, when to swing, so forth. It's all timing. And if his timing is off, if his nervous system is off, he just doesn't have the timing, and his production or his talents just are not at their optimum. And so that's one of the things that we're looking for each of the internal organs too, to bring up their function to be at the optimum that they can be to help affect healing. Dr. Lawley, you have further words?
Yes, we have some x-rays here that we think that you'll find interesting. This is of the thoracic spine. Some people refer to it as the dorsal spine. It's the spine between your neck and your lower back, and we're seeing over here now that normally that's a front to back or an anterior posterior x-ray, and it should look straight. The spine should look straight, but we can see that towards the bottom of the film it curves way over to the right side, and then it bends upon itself over to the left as the cursor indicates there. And we see over on the left side of the spine, we see a shadow of the heart. So we know that's the left side. I mean, there are a few people born that have the heart on the right side, but most everybody has it on the left side. And then we see all of the ribs or the thorax that protects our lungs and our hearts. And here this is quite a serious scoliosis in the middle back. Dr. Jensen and I see a great number of these type of conditions. And we also see quite a few people with spinal problems that have been to other chiropractors, physical therapists, massage therapists, and they're not totally satisfied with the results, and they're looking for more of a thoroughness and examination, and because there are some chiropractors that unfortunately don't make x-rays of their people's spine before they treat them. And frankly, there isn't anything that's going to show us what's going on the inside of somebody's spine better than an x-ray. So if I'm treating a spine without x-rays, it raises a barometer of what we call risk management to malpractice. And of course, not only is it possible that the patient could be hurt or not respond to chiropractic care if there's no x-rays made of the area that's being treated, but it really reduces the likelihood of them having favorable immediate response as well as long-term positive effects. So now we're going to look at another x-ray of the thoracic spine, and this is a side view. Kind of confusing to look at initially, but if you look at the back part of it, you're going to see the ribs. They're rolling around from the back to the sides. And then, there we are. Then we're going to see the vertebra. And there they are there, the vertebra. There you go. And then between the vertebra are the shadows of the discs. And in this and then all of the other business out front is lung tissue and heart tissue and overlapping rib tissue. And of course, the black marbling area is oxygen within the lungs that is less dense, of course, than the bone. And on the front edges of the vertebra, we see some little kind of like spurs. They're called spinal spurs or osteophytes. Some people call them ankylosing spondylitis. They have different degrees of it. Sometimes it's osteoarthritis. But those little spurs are out there because that person had an injury in there many years ago, or some type of injury. They can't remember what it was. And it wasn't correctly treated, wasn't correctly diagnosed, therefore not correctly treated. And the bone is it's actually taking calcium and putting it on the outside of the bone rather than the inside. So now we're going to look at another x-ray view of the thoracic spine. And this one is worse than the last one. It's taken from the opposite side, and you can see this is an adult male spine. The vertebrae are much larger. and there's considerable disc degeneration and arthritic spurs developing there. Now we're going to look at another one, and we see these all of the time in the clinic, and this is another side view or lateral thoracic film, and we're seeing a considerable amount of ankylosing spondylitis occurring in some of those thoracic vertebrae there. They'll point that out to you. See that right there? Those vertebrae there are almost fused together out at what we call the anterior, superior, and inferior margins of those thoracic vertebrae. And if somebody was to go and pound on there, hit in there, be in an auto accident and have that spine whip, or go to a chiropractor and have them forcibly crack your spine without knowing that that's there, that can really cause some serious problems. And that often is why some people who go to chiropractors who aren't aware of those internal issues, that they'll say, gee, I feel worse after I've been treated. And it's because somebody doesn't know it's there, or somebody maybe does know it's there but doesn't acknowledge it. So now we're going to look at another film, and these are all really interesting. This one here is really very, very difficult to look at because it's more of an oblique x-ray of the thoracic spine. We can even see part of the shoulder there, and that black area out there is area in the lungs, and the spine is severely ankylosed. Now let's look at another one, and what we see here is it's just worse. They just get worse and worse if they're not correctly treated. Now many of these people who have these chronic back problems, you may not be able, the chiropractor may not be able to cure them, but they may help you live successfully with them and reduce the propensity of it getting worse and worse through time. Dr. Jensen?
It's an interesting thing about this slide too, is if you look at from the direction that it's on here, you see this ankylosing right down here. It's actually a very large ankylosing and a fusion between here of the vertebrae. And this is from one side. If you look at the oblique, they're actually seeing the right side of the spine from this. And if we went back to this one just before it, there's not as much as, this is the same person, and there's not as much of that ankylosing. And the reason for that, this being on the left side, is that you have the great arteries from the lung coming down on this side, and that beating stops some of that calcium from being deposited. So it's knowing the structures, not just the bones, but the surrounding structures that help you to determine what's going on within the spine.
And much of that is like if it's the body's way of fusing a weak area, much like if an orthopedic surgeon went and took a piece of bone out of the thigh, for example, and fused that area. So now the next x-ray we're going to look at is actually an MRI of the thoracic spine. And so in the front or in the back of the film on your right, we see what we call the spinous processes. Then we see the spinal canal or the spinal cord. That looks like that rope running down there. And there you go, right down there. That's the spinal cord. And then adjacent to that in front of it are the bodies of the vertebra. It's a large portion of the vertebra. And then between those vertebrae are disc spaces. And then if you look at the verbiage that we printed out there for you, at the top it says, with the arrow there, it says T7, T8. We're going to talk more about that later. That's a bulging disc there. In the second line, it says T8, T9. That's a diffuse bulging disc. And then there's another bulging disc at T9 and 10. And so here, the brain is like an electrical generator. It's the main power plant. Spinal cord will be like the main power line coming out of that electrical generating plant. And then, of course, the spine is really like the switchboard in the nervous system. Just think of all of those vertebrae as like switches. And if they're on, then it's not going to interfere with the proper flow of nerve and blood supply out to our organs, out to our bones and our muscles and our ligaments. But if there's a vertebra out of place called a subluxation, then it's going to interfere with the functionality of not only our spine, but our bones, muscles, ligaments, and the organs that those nerves and arteries and veins supply as well. So Dr. Jensen is now going to look and take us through those vertebrae, and he's going to start with the first thoracic vertebra. That's the one right in there. Okay, so Dr. Jensen.
Thank you, Dr. Lala. Well, remember how I was talking about when you put pressure on that nerve that's coming out through that tunnel, that it affects different areas of the body. And so as we look at here, the first nerve from the thoracic spine, influences include the forearms, the elbows, the hands, the wrists, the fingers, and the throat. And some of the effects that can come from this, the deleterious effects, is that it can affect your breathing. You have to realize that it not only affects the first rib, which is what creates the baffles around the lungs, but it's also part of those nerves that go into the lungs. So it can have breathing problems like asthma and cough, apnea, which is a problem with getting air in, and then also hand and arm pain. Then we're going to look at the second thoracic nerve. And if you look at the arrow on the left-hand side, it kind of shows you where the level is across the spine, and it's the spinal cord that's the spine there that's in a slight green. The areas of influence include the heart valves and the covering of the coronary arteries. The effects also include functional heart conditions, and certain chest conditions can also be from there. And so T3, to continue on, areas of influence include the lungs, bronchial tubes, pleura, chest, and breast. Its effects include bronchitis, pleurisy, pneumonia, congestion, and influenza. So if you would imagine with me, if we had that string around that nerve, remember, and cutting it off, and we can imagine that that nerve is bringing down the function, because it's not functioning as well, of the lungs, the chest area, and then you release that, all of a sudden the person's like, I can breathe better. So those are some of the things that we look at, and effects that every chiropractor can look at and actually see in their own practice. Let's look at T4. The areas of influence include the gallbladder or common bile duct. Its effects include not only gallbladder conditions, but jaundice and shingles can also be affected from this. Now, shingles is when a person has chicken pox. The chicken pox virus never really goes away. It hides in your nervous system. And what happens is when your immune system goes down, by the way, chiropractic adjustments have been shown to increase your immune system response in your body. But when that is depleted, that virus, which is called the varicella virus, causes herpes zoster, or should we call it shingles, is another name for it. It actually goes out around that nerve and appears in a dermatome just one certain level across there, and it's very painful because it's that virus coming out through the nerve endings. T5, areas of influence include the liver, solar plexus, and circulation in general. Its effects include the liver, blood pressure or circulation problems, fever, and arthritis. And many times we find people who are drinking caffeine, they'll have a subluxation at that area because it changes your metabolism, makes the heart beat faster, changes the tone of the muscle around there, and it pulls that vertebrae out. So a lot of times we can tell that also. Let's look at T6. T6, areas of influence also include the stomach. The effects include stomach problems, indigestion, heartburn, dyspnea. For myself, there's sometimes where I've had nausea and I've gone in for a chiropractic adjustment myself, and that nausea will leave me. It's just, if it's out, that's what you have. How about T7? T7, areas of influence include pancreas and duodenum. The effects include ulcers and gastritis. Imagine if you keep secreting acid in a part and it's just festering away and creating an ulcer, and it's due to just excess stimulation going in there. Bringing down that nervous noise that's coming out of T7 can help affect that a great deal over time. T8, areas of influence include the spleen, and its effects include lowered resistance, or should we say your immune system. The spleen is an organ which introduces your blood volume as a whole to the immune system. It's like a large lymphatic organ is what the spleen is. So let's also look at T9. The areas of influence include the adrenal glands and the suprarenal glands. Its effects include allergies and hives. And should I also say, if you're having a depletion in just being able to deal with stress, that's also adrenal glands. So that's something for you to consider also. T10, areas of influence include kidneys. The effects include kidney problems, nephritis, pyelitis, atherosclerosis, or chronic fatigue. So whenever there's a relationship that they're finding more and more now, particularly with people in diabetes affects the kidney. Well, they're finding that kidney and heart disease seem to affect at the same time. So that's why you have that relationship between kidneys and atherosclerosis, and just helping to improve the function of the kidney by perhaps making sure that it's getting good nerve control to it. And remember, nerve control acts to dilate or contract the vasculature to those areas. So that's by adjusting T10, you may affect healing in that area. T11, areas of influence include the kidneys and ureters. The effects include skin conditions such as acne, pimples, eczema, and boils. So when we're looking at it, again, it's kidneys, it's how you're detoxifying your system. Many times when we detoxify, it's excreted through the urine, so we want to make sure that that's well. It doesn't mean that these are the only subluxations that the person will have. Remember, our head is attached all the way down to our toes are all attached, and so all these things can affect each other and can affect whether you have subluxations in there. So what you do is you have someone who's qualified to do that, and a chiropractor is qualified to go in and find these subluxations and knows the therapies in which to give correction to those subluxations. And therefore, you may find that it helps set you up in alignment so that you can affect healing on your own body in a most efficient manner. Now, T12, the areas of influence include small intestines and lymph circulation. These effects also would be rheumatism, gas pains, and certain types of sterility can also be affected there. When you're looking at T10 through T12, that's going down through your genital urinary area. And if you're not having the nervous control in that area, it's not being able to dilate or contract the vasculature going in there, and so it'll affect your function from a sexual point of view, as well as what we find is people will, when they're having problems with feeling like they're able to void enough, they're constantly feeling like they have to go, they're not able to go sporadically, they can't relax the area in order to start mictration, or should we say urination in that area. So a lot of times these nerves can help that, and there's exercises and things that your chiropractor knows to relax particular muscles that can be pushing on those nerves, as well as correcting those the subluxations in that area. It also will affect your gait and how you walk, because that area controls your gait as the cross crawl, as the leg goes forward in the opposite arm. So those are some of the things that you want to consider as well. Dr. Lala, further thoughts?
Yes, Jesus has told us that where we acknowledge Him amongst men, He will acknowledge us with the Father. And so we don't care if people agree with us or not about we believing that Jesus is a great physician. We're convinced that He is. If we don't have problems with people who don't believe that, that's their choice. We live in a democratic country, at least part of it is yet. But the fact is that where you acknowledge Christ before men, Christ will acknowledge you before the Father. So if we have the flip side of that is where you refuse to acknowledge Christ amongst men, Christ will refuse to acknowledge you amongst the Father. And so get around some spiritual churches, not intellectual. You got a lot of churches today that are nothing but intellectual and music and things like that. Get around spiritual churches that are into the Word, that are really Jesus people oriented, and get to a chiropractor who really loves Jesus, and you'll find greater anointing there, I believe. I truly believe that.